Welcome today to your Pregnancy Pelvic Health recording. This recording is being hosted by the Herts and West Essex Perinatal Pelvic Health Service. My name is Beth and I'm a pelvic health physiotherapist working at West Hertfordshire Trust.
And my name is Sasha and I'm a pelvic health support worker also working at West Herts Trust.
We hope you find this useful.
So the contents of the webinar today are: what is the pelvic floor and how does it work? The effect of pregnancy and childbirth on the pelvic floor, and how to look after your pelvic floor in pregnancy, labour, after birth, lifelong.
We are going to do a bit of myth busting to start off. We will pop a statement up on the next slide and have a think as to whether you think it is true or false, and feel free to pause whilst you think. Is it normal for me to leak urine when I sneeze or cough because I am pregnant? This is false. It is common to leak urine when you complete tasks such as sneezing, coughing, laughing, jumping, or running. We refer to this as stress urinary incontinence. While stress urinary incontinence is common, it's not normal. Urine or wee should only ever leave your bladder at the right time and in the right place, i.e. the toilet or anywhere you are happy to empty your bladder. Anytime wee leaves your body and you don't want it to, this is a form of urinary incontinence. The Royal College of Obstetricians and Gynecologists have recently released data that shows over 60% of women will have at least one symptom of poor pelvic health, and urinary incontinence is considered one of these.
I do not need to do pelvic floor exercises because I have no symptoms of pelvic floor weakness. This is false. It is recommended that everyone completes pelvic floor exercises daily to maintain the strength, function, and flexibility of the muscle. There are a number of things that can impact on the pelvic floor function. Everyone on this recording today is currently pregnant. Pregnancy can cause these muscles to become weaker, and therefore we find pregnancy is a really nice time to start having a conversation about how to look after your pelvic health now and in the future. I do not need to do pelvic floor exercises because I'm planning to have a C-section. This is false. As mentioned previously, pregnancy itself puts added stress and pressure on the pelvic floor muscles. Because of that, pelvic floor exercises are recommended for everyone in pregnancy, no matter what birth you plan to have or may have.
I've been told I have a tight pelvic floor, so I should not do pelvic floor exercises. This is false. A tight pelvic floor does not mean a strong or well-functioning pelvic floor. A tight pelvic floor can result in symptoms of pelvic floor dysfunction, such as urinary incontinence. When somebody is aware their pelvic floor might be tight, it is advisable to concentrate on the relaxation phase of the exercise program, as well as the squeeze section. We will cover this in more detail later on in the recording. So what is the pelvic floor? The pelvic floor is a group of muscles that span the bottom of the pelvis and support the pelvic organs. They also give you the ability to control the release of urine, so wee, feces or poo, and flatus, which is wind, and to delay emptying until it is convenient for you to go. When you contract your pelvic floor muscles, they lift the internal organs of the pelvis and tighten the opening of the vagina, anus, and urethra. The layers of the pelvic floor muscles stretch from the pubic bone at the front, where the line of your underwear sits, to the coccyx bone at the back, which is our tailbone, and to each of our sitting bones. This is a slide that helps you to see what the different functions of the pelvic floor are, some of which we have already discussed. So to support the pelvic organs, control the bladder and bowel function, control the passing of urine and feces, Also has a role within sexual function and your ability to feel during intercourse, as well as to have an orgasm. Also linked in with your breathing, and during pregnancy and childbirth, it's got many important functions as well. Now to consider what may cause the pelvic floor to not do its job properly. So things that happen in our lifetime to cause weakness or dysfunction of the pelvic floor. As you can see, there are many things that you may identify with which are known to cause weakness in the pelvic floor. And this is why we encourage everybody to do pelvic floor exercises.
Effects of pregnancy and childbirth on the pelvic floor. Hormonal changes, baby's weight, changes in the body's centre of gravity, bladder and bowel function, vaginal changes, and pelvic health dysfunction. What to look for. You have any incontinence, such as leaking of urine when laughing, coughing, or sneezing. You need to rush to the bathroom to pass urine or empty your bowels. You have a sensation of heaviness in your vagina. You cannot control your bowels or wind. You have a long-term constipation. You are experiencing pain during sexual intercourse.
For the next part of the recording, we are going to discuss all things you can be doing in your pregnancy to look after and potentially improve your pelvic health.
Hydration and diet. Drink 1.5 to 2 litres of fluid each day. Avoid too much caffeine and fizzy drinks. Eat a healthy, balanced diet, including fibre, fruit and vegetables, beans, wholemeal bread, rice and nuts. Empty your bowels as soon as you feel the urge. And exercise to help stimulate the muscles in the bowel and promote regular bowel habits.
Opening your bowels or going for a poo should be a comfortable and relieving experience. The picture on the slide you can see demonstrates the optimal position for going for a poo. The optimal position is a seated squat, where your knees are higher than your hips. You lean your body weight forward with your arms rested onto your knees, and then with your mouth open, relax your tummy, breathe in deeply to the bottom of your lungs, at the same time allowing your tummy muscles to relax forwards. Take a breath out, increase the pressure in your abdomen by pulling in your tummy, and relax your anal sphincter. Try this for a maximum of 3 or 4 times on the toilet. Pelvic floor exercises. Pregnancy can increase the load on our pelvic floor muscles, so strengthening them during pregnancy and after every pregnancy is essential. This is the same whether you've had a vaginal birth or a cesarean. To complete your exercises, squeeze the back passage as if you're trying to stop wind and squeeze and lift towards the front. Try not to hold your breath or contract your buttocks or legs. Let go fully when you have completed the squeeze. In the following slides, we will discuss the difference between your long holds and your short squeezes, but you must complete both. If you're experiencing any symptoms of pelvic floor dysfunction, like leaking urine, then you should complete these exercises 3 times per day. If you're currently symptom-free but looking to look after your pelvic health, it's recommended to complete once per day. So now let's have a practice as to whether you can find your pelvic floor muscles. It's important never to try this whilst you're actually passing urine, as this may cause backflow of urine to your kidneys, cause an infection, and also disrupt the way you empty your bladder. It can be very difficult to find these internal muscles, but keep trying as it will get easier. Make sure you tighten without pulling in your tummy, squeezing your legs together, tightening your buttocks, or holding your breath. There are 3 possible ways to check if you are contracting your pelvic floor muscles correctly. The first one is using a mirror. The area between your vagina and your back passage, the perineal body, should move upwards and inwards away from the mirror when you contract your pelvic floor muscles. Number 2 would be you could feel inside your vagina with your thumb or index finger. Tighten your pelvic floor muscles and you should feel the muscles tightening around your thumb or finger. And number 3, if you are sexually active and having penetrative sex, you could try to squeeze your muscles during sex. Ask if your partner can feel the squeeze. When you are completing a pelvic floor exercise program, we encourage you to complete some long squeezes as well as the quick, short squeezes. Let's try the longer squeezes now. So when you squeeze and hold, time how long you can hold for whilst maintaining normal breathing. This may be 3 seconds or 5 seconds or 10 seconds. There is no right place to start your hold, just do it for as long as you comfortably can. Relax fully between each repetition and then repeat up to 10 times. Following on from your long squeezes, we want to try the short squeezes. This is a quick squeeze followed by a quick release, but it is not a pulse of the muscle. So after today, we would recommend getting into a routine of regular pelvic floor exercises. If you're symptom-free, like I said, it's ideal to fit these in once per day. If you're noticing any signs of pelvic floor weakness, it's recommended to do them 3 times a day until the symptoms resolve. Perineal massage. Perineal massage can start from 34 weeks pregnant. The perineum is the bit of skin between your vagina and your back passage. Massaging this area from 34 weeks pregnant can reduce the risk of sustaining a perineal tear during vaginal birth. Ideally, you should perform the massage 4 times per week for 5 to 10 minutes at a time, and do not complete the massage if you're experiencing any signs of an infection. How to complete the perineal massage. Make sure to first of all empty your bladder. Wash your hands with warm water and soap. You can use a mirror to help you see your perineum. You may also want to take a warm bath or shower to help you relax the muscles. Find a comfortable position. This can be sitting with your back supported and your knees bent, e.g. in a dry bath, or on your bed with your back supported against the headrest, or it could be standing with your foot up onto a chair. Lubricate your fingers and thumb with a lubricant or pure vegetable oil. Insert your thumb 1 inch into the vagina and massage in a U shape from your back passage to the other side of the vagina. It should be a firm pressure and may feel a little uncomfortable. Try to complete some sustained stretches. The My London Clinic has a great YouTube video on how to complete perineal massage, and you may find this helpful to watch whilst you're completing. Perineal tears prevention in labour. First and second degree perineal tears are the most common type and are unlikely to cause long-term problems. For third and fourth degree tears, there is often no clear reason why this happens, and it is not possible to predict. However, it is more likely if this is your first vaginal birth, your baby is over 4 kg or 9 pounds, you have a long second stage of labour, which is the stage which you push your baby out, or your baby's shoulder gets stuck behind the pubic bone, known as shoulder dystocia. You have an instrumental vaginal birth, such as a forceps or vacuum assisted. By placing a warm compress on the perineum as the baby's head stretches, the perineal tissues can help to reduce the severity of tearing. Your midwife can do this for you. Your midwife or obstetrician can also support your perineum as your baby is being born. This is called manual perineal protection or a hands-on birth. Manual perineal protection can be provided in any birth position apart from in the water or on a birthing stool. It's only used for a short period during the birth of your baby, and it can help to reduce the severity of tearing. Birth positions will be discussed on the next slide. An episiotomy is a cut made by your midwife or obstetrician into the perineum and vaginal wall to make more space for your baby to be born. Episiotomies are done with your consent, and they are only done if your baby needs to be born quickly, often if you are having an instrumental, forceps or vacuum assisted birth, or if you're at risk of a serious perineal tear. Examination after baby, your midwife or obstetrician will carefully and gently examine your vagina, perineum and rectum to see if you have a tear, and if so, what type. They will then advise you if you need stitches. If you have sustained a third or fourth degree tear, you will be transferred to the operating theatre where your muscles will be repaired. You will be given an epidural or spinal anaesthesia so that you can have good pain relief.
Following on from today, If you feel you need further support on your pelvic health following today, you have many options. If you are planning for a home birth, your local perinatal pelvic health service will be from the trust the midwives providing your care work for. If you are unsure, contact the team you assume you're being looked after and we will advise you if there is a change. If you are not under the care of Herts and West Essex LMNS but would like additional support for your pelvic health, ensure you discuss with your midwife, consultant, GP or health visitor to find out what local services are available to you.